Good evening. This is a case study of Mr. Gregory Baker with the diagnosis of schizophrenia, first episode acute phase. A brief description of Mr. Baker. He is a 20-year-old African American with bizarre behaviors in school and at home over the past year, with evidences of delusions, hallucinations, and grossly disorganized behavior and diminished emotional expression. Mr. Baker has been successful academically as a teenager and has recently been suspended from college due to poor attendance. At home, Mr. Baker for several months have been observed to have quit seeing his friends and laying in bed staring at the ceiling, standing and waving his arms on the roof top as if conducting a symphony. Mr. Baker is also observed mumbling to himself and appeared preoccupied with a girl called Anne, under the notion that they are engaged while not dating. According to his family, Mr. Baker has no history of drug or alcohol use. Mr. Baker has denied depression and seemed to not have any disturbance in sleep or appetite. Mr. Baker has never been seen by a psychiatrist and had no prior psychiatric hospitalization. Hospital assessment found Mr. Baker appeared constricted, guarded, inattentive, and preoccupied, paranoid, grandiose, and with romantic delusions, poor insight and judgment. Mr. Baker also has a family history of mental illness traced to his grandmother and mother. Diagnosis for schizophrenia first episode acute phase is based on DSM-5 by fulfilling the criterion of A1 delusions when Mr. Baker stated that he was a joker and he was looking for Batman. He was becoming increasingly preoccupied with a female friend, insisted to his family that they were engaged. He also stated he felt liberated and in tune with the music when he was on the rooftop. He was stating that he doesn't mind staying at a hospital because he believed Anne probably will be there so he can spend time with her. Rationale for the diagnosis also is supported by criterion A2 of hallucinations when he was recurrently seen mumbling to himself quietly. He also stated that he was in tune with the music. He also meets the criteria of A4 of being grossly disorganized behavior, walking into the classroom shouting, his behavior becoming increasingly odd during the past year, and reports of him standing on the roof of their home, waving his arms as if he was conducting a symphony. Mr. Baker also meets the criteria A5 of negative symptoms when he rarely spoke, spent most of his time lying in bed, staring at the ceiling, appearing angry but does not answer. Mr. Baker also meets the criteria B of decreased level of functioning by having had much academic success as a teenager but had been recently suspended from college because of lack of attendance. He has also quit seeing his friends. Mr. Baker meets the criteria C of continuous signs of disturbance for at least 6 months with the inclusion of at least 1 month of symptoms that meets criteria A. That would be his increased erratic behavior during the past 1 year and having been suspended from school due to his erratic behavior for several months, with signs of delusions. The diagnosis is also met with the criteria of D, having schizoaffective disorder and depressive or bipolar disorder, with psychotic features being ruled out because he denied depression and there were no presence of major depressive or manic episodes being reported. Mr. Baker also meets criteria E of the disturbance not being attributed to physiological effects of substance use or any medical conditions. From the report that his family stated that they have never known him to use illicit substances or alcohol, and there was no report of disturbance in sleep or appetite. He was also ruled out for the criteria of having no history of autism spectrum disorder or a communication disorder. At the hospital, he was found to appear constricted, guarded, inattentive, and preoccupied, paranoid, grandiose, and with romantic delusions, appeared to be internally preoccupied, although he denied the hallucinations, and he loudly insisted that all the hospital's food was poisoned. He denied depression and had no disturbance of his sleep or appetite, and had poor insight and judgment, and was positive for mental illness in his family history. Evidence-based treatment plan would be the use of medication, antipsychotic medication, and the recommendation of psychosocial interventions such as individual therapy, social skills training, family therapy, vocational rehabilitation, and supported employment. Mr. Baker will also be referred to a coordinated specialty care program. Medications that are being used to treat schizophrenia would be the second-generation antipsychotics or the first-generation antipsychotics. Second-generation antipsychotics are considered newer and has lesser side effects, so they are of greater preference compared to the first-generation antipsychotics, and it is important to have a full knowledge of the pharmacokinetics of the medication, as well as the pathophysiology of the conditions of the disorder to effectively optimize the patient outcomes when prescribing these medications. Also, it is important to consider when patients are not having a full response to these antipsychotic medications, there may be occasions that a psychotropic medication may have to be added, but one has to consider the benefit and risk in order to maximize the patient outcome of the patients. There are also a huge number of different options when it comes to integrating any kind of psychotherapy or psychological interventions. It is important to consider that insight is closely associated to medication adherence. According to reports, it is beneficial to include interventions that can enhance the insight of the patient, so that patient will continue to have a higher medication adherence in order to be effective in the treatment of schizophrenia. Coordinated specialty care will be a program that will be referred to Mr. Baker, because coordinated special care is a type of program that addresses the needs of people experiencing first episode psychosis or first episode schizophrenia. This program helps to foster recovery and prevent disability. Coordinated specialty care It's a program that is comprehensive in nature and is managed by a team of specialists and encompasses services such as case management, counseling, peer support, employment and education, medication and management, cognitive and behavioral-oriented individual and group psychotherapy for family support and education. Mr. Baker, having the diagnosis of first episode schizophrenia, will greatly benefit from this treatment.